Hello again, it's Harry here, your geriatric nurse from Toronto, Canada. Back for more information dissemination for the care for the older adults and their caregivers. Tonight, I just wanted to discuss something that's very close to my heart: responsive behaviors. So, because I've been seeing a lot of these videos about dementia, and some of the speakers even pretend to be people living with dementia. And it's just that there's wealth of information in the internet that um, for sometimes I agree with, and other times I don't. So that's why when you go to the internet for these things that can be dangerous, as I've said before, make sure if you have any questions, you know your loved ones the best, but your primary care providers will be able to guide you properly. Because sometimes if you go down that rabbit hole in the internet, you may find things that may not necessarily be best practice for the care for dementia. So make sure, be careful when you where you get your information from. So anyway, so for when someone is living with dementia, sometimes responsive behaviors may be a challenge for the caregivers. And as I always say, there's always something that could be done with in any stage of the dementia process the person is. That's why it's very important to make sure to get to know them really well, so that you know how to promote their personhood, what was important to them, what is important to them in whatever stage of the dementia process they are. That's why in my previous videos before, I said if you have received a diagnosis with a chronic progression, it's always important to plan ahead. So that's something that you can do with your primary care provider. You can plan ahead and make sure that your wishes will be respected up to the end. There is a set of assessment tools that professionals use when dealing with responsive behaviors. Here in Toronto, we use PISA's assessment. And PISA has different aspects of the older adult's life that we try to correlate with the behavior. So P for physical, I for intellectual, E for emotional, C for capabilities, E for environment, and S for social. I had the pleasure to work for organizations before, and they also tied functional assessment along with the PISA's assessment. And functions of behaviors correlated with the pieces is very powerful, because in when you look into the function, you are looking into the abbreviation is SEAT, seat. So the person is exhibiting behaviors either because it's sensory, or something they have an internal stimuli. E for escape, they want to escape an unwanted situation, unwanted stimuli. A for attention, so they're doing the responsive behaviors because of attention. And then T for tangible, so they want something, that they want to attain something, and more often than not it's one of those basic needs: thirst, hunger, the washroom, comfort or pain. So PISA's functional assessment is something very good as a guiding tool when dealing with responsive behaviors. Especially with Behavior Support Ontario, they promote the use of and exhaustion, the use, exhaustion, and maintenance of non-pharmacological interventions, which is very important to people living with dementia. We as caregivers, especially the professional ones, we become we try to feel what our patients or what our loved ones are losing each time. Okay, so it's our assessment. So the nursing process assess the ADPI, assessment, nursing, diagnosis, intervention. You plan, you intervene, and you reevaluate. Always go to the basics, and you will have a very good guide in taking care of your patient. So you have that ADPI and your PISA's functional assessment. Together, all these assessments will hopefully be able to guide you in understanding the person living with dementia and being able to promote what is important to them and what was important to them pre-morbidity or before they were diagnosed, which is very important. So that's it for now. This is already a long video. Hope you have a good weekend, guys. Take care and till next time.